Tanya, are you there?
Hello, yes.
Hello, hello.
Hi, can you hear me?
Oh, yes, I can. Can you hear
Okay, there we go.
me?
I
Okay.
can, yeah.
Hey, hi, welcome.
Thanks.
I'm just,
I'm
oh, hi.
just doing some work, multitasking.
I love it. What we all do best.
Yes, yes, for sure.
I'm just gonna wait.
I don't think I see you.
I think we met once when I was doing a class with Amy.
Oh, okay.
Yeah.
Okay, great. Well, good to see you again.
Yeah, it's nice to meet you and see you again. I'm excited for today. I'm so sorry I had to reschedule a couple times, so I'm glad this is working out.
Life happens, right? Life
That's
happens to everyone.
That's it, my love. But thank God, all blessings. Everything is fine and well and
Good,
healthy and happy.
good. That's the main part, right?
That's right. I'm just going to give everyone a few more minutes before we begin.
Okay.
I saw you ask several questions.
Yeah,
I love
I'm
it.
always asking questions.
I love that. That's how you get answers rather than just ruminating in your mind about things, right?
Oh, totally, totally. And that's the point, right? Just handing it over.
That's right. Surrender to the process. You're here. Team Amy is incredible. Um,
Yeah.
so we're here
Such a great group of women. It's awesome.
Yeah, I agree. I love this group. I mean, I love all the groups, but there's a lot of cohesiveness with this group.
Okay.
Have you noticed that?
I have. I
Oh,
have. Yeah. It seems like everybody's kind of in sync on everything that's happening.
yes, good. Are you connecting with women over like WhatsApp?
I am. Yeah, we started a group and that's been really, really nice.
Amazing.
Um, yeah, because then I don't, then I don't make my husband my journal.
Oh,
Not that he minds. He doesn't mind. It's just, it's just different.
absolutely. It's different connecting with women that are on their journey with you. You share a lot of things in common, and it's nice to get their feedback and input.
Yeah. Yeah, for sure.
He's there for support, which we love.
Yes. Yes, absolutely. He's so great.
Oh, amen. I have an earth angel as well. I'm very blessed. I thank God every day. Where do you live, Tanya?
I'm in Sacramento, California.
Oh, how dreamy.
It's nice. We've had some pretty hot days lately, but overall, like, I just can't ask for anything better. We just go to the ocean if we want to go to the ocean. We go to the redwoods. We'll go over to Tahoe if we want to. It's Sacramento itself is just kind of this little cow town almost,
Uh-huh.
but everything around it, like you pretty much get anywhere within like 3 through 4 hours drive.
Wow, that's incredible.
Yeah.
Sounds magical.
Yeah, I need to take more advantage of it for sure.
Yes, absolutely. It's so healing and therapeutic.
Hmm.
I love
I'd
Cal.
love to get outside any chance I get.
Yes, good. Nature is really healing. We say in Chinese medicine that it helps to soothe liver qi for those that are feeling like irritable and stressed and maybe depressed. It really helps to calm it and to move it through.
I believe it.
Yeah,
I
yeah.
believe it. We're lucky enough to live 3 blocks away from the Capitol, and the Capitol Gardens are actually really nice. Like, there's just a lot of just cool stuff, and I'm not talking about the homeless people, but like it's just really, really like, and even there, it's like you find that the beauty and like everybody has their own things that they're dealing with, their own struggles, their own stuff, you know?
Yeah, yeah, absolutely. And we send them love and blessings.
Mhm.
I can't imagine how challenging it has been for many people. I hear there's a
Yeah.
lot of homelessness going on in California right now.
It used to be a little worse. I mean, I was actually just in the Bay Area yesterday and it wasn't as bad as I thought it was in San Francisco. So like even Sacramento, we're like, oh, San Francisco. Then you go over there and you're like, whoa, it's actually not as bad as like it's made out to be. So it's all about, what we hear and actually seeing things for ourselves.
Yeah, my girls in San Francisco, they really haven't, when I asked them about the homelessness, they said there's some, but nothing that that is, making them nervous or wary. I guess they might be used to it as well, but I heard there was an
Right.
increase.
Yeah, there is that.
Yeah. Okay. I'll give just 3 more minutes and we'll begin. You
Okay.
can turn your camera off if you need to, my love. I
Okay.
understand you're working.
I'm actually ordering an AMH and FSH test right now because I realized I haven't done it in a while, and today is like day 3. So I'm like, I should probably check. It's been at least like a year and a half. And I'm kind of curious because I've been doing the egg quality diet since about April.
Okay.
So I'm kind of curious to see where things are at anyway.
Yeah, good. Is Sarah your coach?
Yeah. Yeah, I signed up with Amy's VIP program, so I don't know if that makes Amy my coach or Sarah.
I guess both, right? That's
Yeah, okay.
a good
Okay.
question. You're good. Both Sarah and Amy are incredible.
Yeah.
You're in good hands.
Yeah. Just like I'm just gonna go for it.
Yeah, I love that. Good for you. Why not? If you can, if you're blessed to, absolutely.
Yeah. Yeah. And yeah, we're blessed enough to do that for sure. We've kind of decided like this is important for us. And
You're gonna make the
I
investment.
I've been trying to do everything myself, and I've gone down some deep rabbit holes. Um, like in terms of supplements and just a lot of different things like Wern. I don't know, I'm looking at doing that Wern clear passages therapy, um, spirit baby stuff. I love all of it. Um, but I'll go down like deep rabbit holes, like looking at these supplements. And that's really been like my biggest stressor is, I mean, you'll have like, I don't know, Dr. Amy, the egg whisperer, tell you, oh yeah, take 1,000 NAD every day. And it like your body gets used to it. So I don't know if that's the right thing actually, and taking like just handfuls of the stuff, like it just like after a while, you're just tired.
Mhm.
So that was my biggest, like what made it really nice for me was just handing it over.
Right. And having an individualized treatment made up
Yes.
for you and not just a general list of supplements that are good for fertility.
Yeah.
Right. Because those
Yeah.
are
And I,
growth as well.
yeah, I expect it'll change a little bit with the tests that I do. I haven't done any of the tests yet. I just got them actually Friday. So I gotta wait for the however I'm supposed to do the Dutch test. I know it's towards the end of the cycle. So that'll be in about 2.5 weeks.
Okay. Yeah, and once you start completing those, if you have any questions, you can reach out to Amy or Sarah. Of course, like the support team as well. I'm here for you too.
Okay.
Let us know whatever questions you have and we'll guide you.
Okay,
Pretty
cool.
straightforward, easy. But like Amy always says, like she's, when she did the Dutch, she would set her timer just so she was like on top of it, not forgetting what to do, the steps along the way.
Okay.
Yeah, you'll read through it a few times before you do
Yeah.
it.
Oh yeah, for sure.
All right. I think we'll get started. I'm just going to turn my camera for 1 second because I have to get my questions.
Great. And go grab earbuds.
Okay. Tanya, let me know when you return.
Okay, I am back.
Okay. All right, we'll get started. I don't see anyone that is in the waiting room. So here we go. Hello, everyone. I'm Heather, and I'm one of the fertility coaches on Team AIMEE. I'm also an acupuncturist in AIMEE'S NIAC clinic. My apologies. I said to Tanya already, I'm so sorry for having to reschedule the weekly office hours a couple of times. Thank you all for being patient and understanding. I'm so happy to be here with you today, so let's get started. Okay, first question is from Damiante. She asked, do you recommend taking the following supplements to improve egg quality, which are L-carnitine with allicin? So let's talk a little bit about what carnitine and allicin do. So to be honest, I'm not familiar with L-carnitine with allicin. So Damiante, I'll reach out to you personally and ask you if you can send me the supplement that you're referring to. But basically, carnitine is an essential nutrient for energy production, and it plays a crucial role in transporting fatty acids into the mitochondria. Allicin is a compound found in garlic, and research does show that it can help with fertility by, I guess, regulating the menstrual cycle and balancing hormones. We typically don't recommend L-carnitine because you can fortify it with your diet. So basically, you can get it through your diet or take a supplement. If you follow the egg quality diet or any of AIMEE'S diets, you don't really need an additional amino acid, especially if you're drinking bone broth regularly and taking collagen. However, one caveat, if your gut health is compromised, meaning you're not having a daily healthy bowel movement, which is shaped, like AIMEE says, shaped like a banana, easy to pass, you feel incomplete, and if you're gassy and also experiencing, I guess, frequent bloating or indigestion, which is like, heartburn, burping, etc., you might need to take this as a supplement if you're not absorbing your food. Damiante also asks if we recommend myo, ND, chiro, and inositol. And the answer is yes. Inositol is a nutrient closely related to the B vitamins, and it especially is helpful for PCOS, which is the polycystic ovary syndrome, because it can help with insulin levels. Inositol may also help lower insulin. It's been shown to improve egg health and might even increase the chance of ovulation. And as you see, myo and chiro and inositol are considered like a dynamic duo for fertility because they can support ovulation, egg quality, and regular cycles, as well, of course, as hormone balance. Okay, Tanya, here we go. Questions from you. You wanted to know microdosing HGH for egg quality 1 month before IVF cycle. So I did review this with AIMEE as well to get her input. And I think overall, we haven't seen it make a big difference, and it is quite expensive. Dr. Murphy has always said PRP is your own growth hormone. So why would you want to use someone else's or animal growth hormones? If you want to do something, consider the PRP. I don't know if you've talked about that with AIMEE or Sarah, but I would consider it. And as you probably heard AIMEE talk about PRP, it's an ovarian platelet-rich plasma, right? And it can improve quantity and quality of your eggs. So basically, when PRP is introduced into the ovaries and the uterine cavity, it stimulates cellular rejuvenation, rejuvenation and blood flow naturally and effectively. So basically, PRP, Dr. Murphy says, is more powerful than human growth hormone.
Okay.
Have you reviewed that with AIMEE and Sarah? You don't have to.
No, I have. I've actually done it a few times, and that was like another question that I had was the last time I did PRP was the adipose stem cells plus the PRP in April with Dr. Murphy. And I have a cycle in October, an IVF cycle in October, and I was wondering if it would be too much to do another just plain PRP.
Okay, so you have the adipose done. Remind me of the timing. I'm going to write this down.
April this year was
Okay.
when I did the adipose plus PRP with Dr. Murphy.
Okay.
And I have an IVF cycle coming up in October. So I was wondering if it would be too much to do another PRP in August. I know that's right now, but
Yeah, and I wonder if that's aggressive, right? Because the
Right.
adipose, they say give 8 months, right? Where PRP, they say 3 months
Hmm.
for its full potential. Has it something you discussed with Dr. Murphy as of yet?
Not yet. I actually emailed them, so I'm waiting for a response back.
Okay. Yeah, when he comes back to you, bring it to us and we could help you make a decision.
Okay.
Have you talked to him about human growth hormone and has he mentioned the same things that I just mentioned?
I haven't asked him about it.
Okay.
No, it was something that Dr. Amy, the egg whisperer, had mentioned, and I did do it for, I don't know, I think about a month and a half.
Expensive, right?
And it's, well, I don't know, it's so hard to correlate everything because we got pregnant in December, and in November, October, November was when I did the human growth hormone microdosing. So I don't know. You can't really always correlate things with
Agreed.
stuff sometimes. Um, but the reason I ask is because I do have like a leftover like omnitrope, and I'm like, well, I don't want it to go to waste. So
Oh, okay. Let me bring this to Amy and Sarah's attention.
okay, thank you.
Take notes. But I'm glad you did the adipose. I'm hearing really good results with that. Okay, and then you had another question about WERN, the clear passage therapy,
Yeah,
and whether or not it's beneficial. And
yeah.
we
I'm like,
say
how do I
sure.
know if it's for me?
Right. So, clear passages, I've heard of it before, but I haven't had anyone in my practice or any of my coaching clients do it.
Mm.
Um, but sure, we really encourage anything and everything to improve ovarian blood flow. As you know, we recommend things like the Mayan abdominal massage,
Mhm.
acupuncture, pelvic floor PT, Wubenzyme, or Ceregold, and of course, castor oil. Are you doing any
Oh
of the,
yeah,
okay, you're doing,
everything,
okay, good. So you
all
do
of them.
Benzyme or the Ceregold?
Hmm. The
Excellent.
Wobenzyme, both.
Okay, great. And for those that are unfamiliar with clear passage therapy, basically it's a specialized form of manual physical therapy designed to address any adhesions and restrictions in the body's connective tissues. The therapist will use their hands to manipulate the fascia tissue, gradually breaking down the adhesions and restoring normal tissue mobility. So basically, when the tissue becomes tight or restricted from inflammation and things like that, it can cause a range of health issues from pain to fertility challenges. Have you found someone local that does it there?
No, but I see that they have a clinic up in Reno. So that's where I was thinking, or unless there's somebody local here, but I haven't researched it that far yet.
And I was looking into that. I forget when, some time ago, and I saw it's a big commitment,
It
right?
is. It
Yeah.
is. It's a big financial commitment too, with
Yeah,
like through
financial.
their program.
Yes. So I wonder if you would even need to go that route if you're doing all the things that Amy is recommending, as well as Sarah, of course.
Yeah.
But, do some research on it and, get back to us and let us know your findings.
Okay.
And then we could, of
Okay.
course, tell you whether or not we think, like, go for it.
Okay.
Um, and you were also told by your RE that you should stop hot yoga while trying to
Yeah.
conceive. You said, I feel so great when I do it. Is it really true? Should I stop it because it raises BB too much? Ugh. And the truth is, we don't love hot yoga while you're trying to conceive.
Okay.
However, if you wanted to continue, we would suggest 1 to 2 times a week in the follicular phase only.
Okay.
Hot yoga can increase your core body temperature and cause dehydration, right? Because all the sweating.
Hmm.
And when you're trying to conceive, and especially during IVF, we want to avoid raising the body temperature to extremes.
Okay.
Right. And for some of you that may have done hot yoga before, you may have felt that panic in class. They might faint or maybe even like a racing heart. When the body is overheated, very hot or overworked, it can move into a stress response. And in class, there's always this underlying feeling that you should push your body, that you should be leaving it all on the mat, including a puddle of sweat, which can be depleting for many. But I get it. I also like hot yoga, but I'm also mindful and how my body feels. I'm of course drinking plenty of fluids when I'm doing it. And I'm mindful of when I'm doing it in the cycle. In Chinese medicine, for example, if you have moderate to severe qi or yin deficiency, which I don't know if you have it or not, you would not do well with heat in a hot yoga class, right? And the loss of copious amounts of fluid through sweating that occurs would be especially damaging. You may be asking yourself, you know, what is qi and yin deficiency look like? And I'll tell you. A qi deficient person looks like the following. Basically, they have fatigue, weakness, lack of strength, shortness of breath, spontaneous sweating, and a yin deficient person may have night sweats, dry skin, dry mouth, a sensation of heat, and also sometimes disturbances in sleep patterns. We say in Chinese medicine that the yin provides a substance and foundation for bodily fluids. Its deficiency can impact basically your overall health, including fertility. So be mindful of that. But if you're going to do it, like I said, 1 to 2 times and only during the follicular phase. Are you sad about that?
Ish, you know, because like thinking about going, I'm like, oh, it's so much work. But then after I'm done with it, I'm like, oh, that felt so good.
Yeah, I get it. I get it. But there's so many other things that you can do that feels good as well. Do you have that video of Amy talking about exercise and fertility?
Yes.
Okay, good. Good. I always like that video. I think it's really helpful to guide and to know like what's too much, what's depleting, what does overexerting actually mean? Because it could mean different things for all of us, right? Like some people might be used to CrossFit, other people are just used to like strolling, right? In a park. Okay. And then you wanted to know, is this your question? Yes, right? We are timed intercourse with letrozole. Is that yours?
Yeah.
Okay.
With the DHEA.
Yes.
Yeah.
Okay. So I'll say the question. I'll read the question. I mean, just so others that are going to watch this recording couldn't know the question. So we are timed intercourse with letrozole cycle days 3 through 7. I'm also on DHEA 25 milligrams AM and PM, which is a total of 50 milligrams, right? You said I was told by my previous RE that I shouldn't take DHEA with stim meds. How should I approach this? Perhaps just stop the DHEA during cycle days 3 through 7, then resume? Yeah, that's fine. And we agree with this doctor. Most REs in general want patients to stop everything during stims. We don't, you know, agree to that extreme. The one thing I would say is if you're having a fresh transfer, just stop the DHEA. But I like the idea of just stopping it during cycles day 3 through 7 and then resume. And regarding the 50 milligrams of DHEA in total, every case is different, but in most cases, we will only recommend 10 to 25 milligrams of micronized DHEA and no more than 25 milligrams in a total daily. I don't know if you've talked about that with Amy and Sarah before.
Yeah, mine was really low. It was like 54. DHEA level was 54 without any supplements. And then I brought it up to 133 with 25 and 191 with 50.
Okay. All right. I would review it with Amy and Sarah. I would just say what you just shared with me, like the benefits you received, because high doses of DHEA can tax the ovaries.
Okay.
So talk to both of them. I'm sure you're on a chain email with both. And for those that are considering DHEA, we always say before you take it, we recommend testing the DHEAS levels as well as the testosterone levels to make sure that DHEA is needed. Okay. And then we have questions from Linda. She asked, I would like to know if antibiotics can affect hormones. It's a good question. It seems that some women, while taking antibiotics, don't experience a disruption in their hormones or cycle, while others do. And so since antibiotics and hormones both need to be processed by the liver, it does make sense that taking antibiotics may affect both estrogen and progesterone metabolism. Some may notice an impact in their menstrual cycle, even if the antibiotics were not prescribed specifically for an infection of the reproductive system, such as, urinary tract infection, bacterial infections, or maybe some yeast infections. However, in the process of killing bad bacteria, antibiotics can also destroy good bacteria. So it's really important and essential to take a probiotic to counteract the antibiotics effects. You could also consider eating at least 1 to 2 tablespoons of fermented foods like sauerkraut or kimchi while taking your antibiotic, that is. Also, we recommend taking or drinking 4 ounces of bone broth daily. But while taking antibiotic, I would suggest even drinking 8 ounces of bone broth every day. Increase it to 8 from 4 ounces, that is. This will help heal and seal your gut lining and mitigate any damage the antibiotics may have caused or may cause. All of these things will help repopulate the gut flora with good bacteria. So it's really important that you're mindful about that. Okay, let me go to the next question. And this is from Ruchi. I hope I'm saying your name correct. And I'm going to meet you soon. I'm so excited. You said, I do not eat dairy and meat. I want to know if it's okay to take vegan protein powders to meet daily protein consumption. Sure. However, being that protein powders can be highly processed, be sure to read all the ingredients. There can be additives and preservatives that are not essential to our health. I would check out the following. Let me just think about the brands. Give me a moment. Sun Warrior, Truvani, as well as Garden of Life, raw, organic protein, plant-based. These are really good brands. There are also other good brands, and we could talk about them, and anyone else who's listening to this that's considering doing protein powders, please reach out to your coach and we can give you brands that are AIMEE approved. You said also my acupuncturist suggested me to take melatonin 3 milligrams before sleeping. Although I sleep 7 to 8 hours a day, should I take it? Are there any side effects of it? So melatonin is best known for its role in regulating sleep-wake cycles. And there is emerging research that suggests it could also promote regular ovulation and act as an antioxidant for egg and sperm quality. However, we do not recommend taking 3 milligrams of melatonin. We have seen that this can inhibit ovulation in some women, We do recommend taking 1 milligram and no more than that, preferably a slow release one like Clear Labs is a good option. I could also, there's 2 other brands too. I can't think of them right now. But once we talk, I'll share that information with you. So basically you're sleeping well and you want to know if you should add it. You can, because it does give you like the egg and sperm quality benefits, like I mentioned, but you could also do that with other supplements that we'll discuss. Okay, let me see if there's any more other questions. Bear with me for one moment. I'm just going to check out the Money Networks. And if not, we can wrap up. I'm actually going to be heading to the clinic. I'm going to see patients today. And Tanya, of course, if you have any other questions, please ask away.
I actually do have one more question. AKG, the supplement alpha ketoglutarate phospholipid complex. Do you guys have a recommended brand for that?
What is it called? It's
called AKG, and I know that AIMEE is working on adding it to Rejuva.
Okay.
And I'm currently taking the Code Age brand, but I'm wondering if you guys have, or if you recommend something else.
I like that brand actually.
Okay. Cool.
What I could do is I could see the ingredients and tell you whether or not I would resume taking it, or if it needs to be substituted with something else.
Okay.
If I could pull it up. Give me one moment, please.
Mhm.
Mhm. Yes, this looks good.
Okay. Cool.
Yes. Okay. And let me look at Money Networks. Bear with me for one moment. Okay, that's all the questions. Let me maximize my screen so I could see you. Oh my gosh. My camera was off.
Okay.
I minimized and I didn't realize I never turned it back on.
That's okay.
Okay. Well, if you have any further questions, please ask. You could email me. Anyone on this call could also email me. If you have any questions regarding my responses. My email is heather@AIMEE'S.com. Yeah, so if you have any questions regarding my responses or additional questions, I think that the next office hours is hosted, or there's a Q&A maybe this week with Sarah, or next week. I don't recall now. But either way, we're all here available to help all of you on your journey. And I look forward to working with you going
Awesome.
forward.
Thank you.
All right, Tanya, have a great day. Bye,
You
everyone.
too.
Take care.
Bye.